Dennis Rock. I'm a equine veterinarian. In terms of doing equine dentistry, there are two types of shafts that are primarily used. This is the guarded right angle with a flat disc, and this one is a reverse cone, which is called the chamfer, with a brass guard, bushing guard on the end of it. This protects the cheek or tongue while the floating procedure is being done, as does this guard on the other right angle. Both instruments are used to accomplish this goal. There's a positioning stance to take, and you should stand in the eagle position, which is like someone who's playing hockey. So if you're going to work on the horse's left side, you will always have the left hand on the shaft, whether it's the upper or lower arcade, and the left foot forward towards the horse. If you're going to work on the right side of the horse, in the eagle position, you will be standing with your right foot forward and right hand on the shaft, whether it's upper or lower arcade.
There are four major gripping techniques when holding PowerFloat bits to a horse's mouth: the pull cue hold, the overhand grip, the modified pull cue hold, and the thumb and forefinger grip. Depending on your PowerFloat positioning in relation to your patient, there will be an appropriate hold for every angle you're trying to reach. The techniques presented in this video are necessary to effectively work on a horse's arcade. Always ensure that your stance is the correct one when engaging in PowerFloat procedures to avoid injury to your patient and yourself. The pull cue hold refers to having the shaft resting in the web of the hand between your thumb and first finger. The overhand grip shows the shaft held over the top with a firm fist-like grip. The modified pull cue hold is gripped as a pull cue, but your wrist is rotated outwards to allow your middle finger to retract the horse's cheek. The thumb and forefinger hold is used when PowerFloating with a right angle bit. Your index finger is placed in front of the right angle portion, or bend of the bit, above the grinding disc. Your thumb is placed on the rear portion of the right angle bend of the shaft, above the grinding disc. This placement allows the middle finger to pull or abduct on the horse's cheek when needed, depending on which side of the mouth the procedure is being performed. In all cases, your ring and pinky fingers are held outside the horse's mouth. The middle finger is always inside the horse's cheek during the modified pull cue and thumb and finger techniques.
So in order to access the upper arcade with this right angle, grasp the shaft of the float with a pull cue sort of configuration in your hand. This will allow you to access the opposite side of the mouth. You'll introduce the shaft of the float diagonally across the mouth and access the upper arcade. When doing the lower arcade, the right-hand side of the horse, you will still have your hand on the shaft with an overhand grip. In this case, you'll be standing directly in front of the horse with your right foot forward and pull out the corner of the cheek with the shaft. The shaft pushes on the corner of the cheek, and you access the handle arcade in this fashion. Pushing the cheek out, your line of sight is under the shaft, and you can watch the device float the teeth all the way from the front to the back. On the left side of the horse, we have left foot forward across the mouth using pull cue technique. And to do the lower arcade, we will stand in front of the horse, overhand grip, again, left hand on the shaft, push out the corner of the mouth with the shaft so that your line of sight is straight down the center, and you can access the teeth in that fashion, standing directly in front of the horse. This again is the chamfer burr. It has a guarded brass bushing on the edge of this reverse cone. And this device is only used to remove sharp enamel points. It's not used to reduce anything on the occlusal surface. If we begin on the upper left of the horse, left foot forward, move diagonally across the mouth, float the outside of the upper. Because the chamfer burr is in this position, we would go from the upper left to the lower right because we'll be floating on the inside of these teeth. So pull out the corner of the mouth so we can see. We will run the burr up and down this side. So we've done the upper left and then the lower right of the horse. To do the upper right of the horse, right foot forward, right hand on the shaft, pull cue. Access the far of the mouth, and then we will move to the inside sharp points of the lower left. Left hand on the horse, pull out the corner of the mouth with the shaft, and run the device down to do that. We've now floated all 4 arcades. If we're going to do some reductions on the teeth themselves on the occlusal surface, we will have to use the other attachment. The right angle attachment can be used to remove sharp enamel points as well, but its primary use after the chamfer is to reduce malocclusions, dominant projections on the teeth. Starting on the upper right hand side, we'll once again right foot forward, pull cue, hook onto the edge of the speculum so you're one with the horse, and introduce the float into the mouth. We are able to reduce points as needed. I'll move to do the left side of the horse, the left foot forward, left hand on the shaft. In order to do the lower teeth, we have to move this to the down position. And on the horse's lower left, I'll stand in front of the horse once again, left foot forward. And I'll abduct the corner of the mouth with the shaft, forcibly abduct the corner of the mouth so that I can see. I can run this down and work on any part of the arcade. Once I'm done this, I'm still in down position, so I will change to right foot forward, right hand on the shaft with an overhand grip. And I can work on this arcade. In order to do the contouring of the front teeth, the 06s, 106, 206, 306, 406, it is necessary to take a different position standing in front of the horse. These teeth come to a knife edge or an apex, and it's this knife edge, this sharp surface that needs to be blunted. Take an overhand grip and position my wrist against the speculum so it's steady with the horse. And then I am able to introduce this across the mouth to get this 206 tooth. And I don't have to guard this at this point because the right angle is tilted away from the cheek, so this will not abrade the cheek. In this position, I can float on this tooth and round it, around the bottom and then around the front. Generally speaking, I've only done half of the tooth because of position. You can't necessarily get directly in front, so I usually get only the front and the buccal side of the tooth. In order to get the palatal side of the tooth, I have to make a different approach from the other side. And in this case, I'm tilted towards the cheek. I'm still at right angles to the tooth, but I'm tilted towards the cheek, so I have to pull the cheek away to keep it from getting abraded. So I go to pull cue technique, and my middle finger pulls on the cheek outwards so that I can work on the front of this tooth. Once I've done that from both sides, the bit seat is done. Contouring the 6s is done on this side. Now I can go over to the other side. I'll go across the mouth. Now I'm on the horse's right side, so I have left hand on the shaft. I'm at 90 degrees to the tooth. And I'm going to go up and contour this tooth as much as I can. Since I've only gotten it from one side, I need to switch and go around. Once again, I'm tilted towards the cheek, so I have to change from overhand grip to pull cue. Pull the cheek out so it's away from the tooth, and then I can finish contouring the teeth from this angle. 2 rows of cheek teeth have been contoured at the front. In order to do the lower cheek teeth, we'll start with 306 on the left side of the horse, and there's a fold of tissue in front of this tooth called the mandibular frenulum. If you were to grind on the front of the tooth, you would cause abrasions against the mandibular frenulum and some bleeding, so you must pull the frenulum out of the way. So in this approach, we go from overhand grip to pull cue, and then we go to modified pull cue by introducing the middle finger into the mouth to pull on the cheek and the frenulum at the same time. Once that's tight, we're able to float on the inside front of this tooth. Once again, I've only got one side of this tooth, so I have to go to the other side. I still have to push the cheek out and tighten the mandibular frenulum, and so I have to approach this differently from this side. Again, it's 90 degrees to the tooth, but this is, my finger is placed here, my thumb is placed on the edge of the guard. My middle finger will now push out on the cheek, and now I can finish smoothing this tooth from the front and the buccal side of the tooth. So this is called thumb and forefinger technique. Now that I've done this side of the tooth, I can come over here to start on the horse's lower right, number 406, and I'll go back to overhand grip to modified pull cue, where I can take my middle finger in and pull on the mandibular frenulum of the cheek and start smoothing the front of this tooth. Once I finish smoothing that part, then I will have to go over to the other side of the horse, change hands, standing directly in front of the horse again, and in this case use my finger and thumb and forefinger technique with the middle finger pushing the cheek out, and I'll finish floating the tooth in this manner. Once that is done, the dental procedure is complete.